What is generalized anxiety disorder? The majority of us worry about things like health, finances, relationship and family problems. But people with generalized anxiety disorder, GAD, worry significantly about these and lots of other things alongside, even when there is little or no reason to worry about them. People who experience anxiety become very anxious about just getting through the day. They think in a catastrophic manner that things will always go badly. At times, the anxiety and worry keep people with GAD from doing everyday tasks. GAD sometimes runs in families, so it may be useful to explore your family background. No one knows for certain why some people experience anxiety while others don't. Researchers are looking for ways in which stress and environmental factors may play a role with how anxiety may develop in order to help support treatment of anxiety. People with GAD can't seem to get rid of their anxiety and worries, even though they usually realise that their anxiety is more intense than the situation warrants. They find relaxing difficult, startle easily, and have difficulty concentrating. Physical symptoms that often accompany anxiety include fatigue, headaches, muscle tension, muscle aches, difficulty swallowing, trembling, irritability, sweating, nausea, having to go to the bathroom frequently, feeling out of breath and hot flashes. GAD may develop slowly. It often starts during the teen or young adulthood years. Symptoms may get better or worse at different times, and often are worse during times of stress. When their anxiety level is mild, people with GAD can function socially and hold down a job, for example. They generally would not avoid certain situations as a result of their disorder. People with GAD can have difficulty carrying out the simplest daily activities if their anxiety is severe. GAD is diagnosed when a person worries excessively about a variety of everyday problems for at least 6 months. People with GAD may visit a doctor many times before they find out they have this disorder. They may ask their doctor to help them with headaches or trouble falling asleep, which can be symptoms of GAD. It may take doctors some time to be sure that a person has GAD instead of something else. If you think you have an anxiety disorder, the first person you should see, as mentioned, is your family doctor. A doctor can determine whether the symptoms that alarm you are due to an anxiety disorder, another medical condition, or both. The doctor may then refer you to a mental health specialist for treatment. GAD is generally treated with psychotherapy, medication, or both. A type of psychotherapy called cognitive behaviour therapy is especially useful for treating GAD. It teaches a person different ways of thinking, behaving, and reacting to situations that help him or her feel less anxious and worried. You should feel comfortable talking with a mental health professional you choose. If you do not, you should seek help elsewhere. Once you find a mental health professional with whom you are comfortable, the two of you should work as a team and make a plan to treat your anxiety disorder together. Remember, if you start on medication, it is important to not stop taking it abruptly. Certain drugs must be tapered off under the supervision of a doctor, or bad reactions can occur. Make sure you talk to the doctor who prescribed your medication before you stop taking it. If you are having trouble with side effects, it's possible that they may be eliminated by adjusting how much medication you take and when you take it. Many people with anxiety disorders benefit from joining a self-help or support group and sharing their problems and achievements with others. Talking with a trusted friend can also provide support, but it is not a substitute for care from a mental health professional. Stress management techniques and meditation can help people with anxiety disorders calm themselves and may enhance the effects of therapy. There is preliminary evidence that aerobic exercise may also have a calming effect. Since caffeine, certain illicit drugs, and even some over-the-counter cold medications can aggravate the symptoms of anxiety disorders, they should be avoided. Check with your GP or pharmacist before taking any additional medication. It is also worth noting that family is very important in the recovery of a person with an anxiety disorder. Ideally, the family should be supportive, but not help perpetuate their loved one's symptoms. Family members should not trivialize the disorder or demand improvement without treatment.